If you ever want your knee to go fully straight again after ACL surgery and you don't want a puffy, achy knee forever, this video is for you. What's up, guys? Welcome back to the channel. This is Dr. Joe Ruskowski, physical therapist at IDPT in Livingston, New Jersey. And today what we're going to talk about is getting your knee back to full extension range of motion. That's the biggest actual limitation that I see with ACL rehab. Even people and athletes who come in months and months after surgery, they say, oh, don't worry about it, like my knee is fully straight, but I'm still having this aching pain. I'm still having limitations. I feel like I just lost a step. And the first thing we do in the evaluation is look and see, well, do they actually have a full knee extension? And they don't. Almost any time do I actually see a full knee extension. And so what we want to talk about is what full extension actually means, and then what are the best ways that we do at IDPT to get it back. Before we do that, what I want to talk about are some alarming statistics regarding knee extension range of motion after ACL rehab. It says that up to 59% of athletes after ACL reconstruction have any degree of extension range of motion loss. That number does drop, but still 33% of patients have more than 3-degree loss of extension after surgery, after rehab, which means a whole 1/3 of people are missing more than 3 degrees of extension. What these studies also show is that if you have these deficits by still at 2 months, which is what most people consider early in rehab, then your chance of ever getting that full extension back drop by 72%. This is an absolute epidemic, because if you don't get knee extension, if your knee never goes fully straight, what does that wind up meaning? Well, that means that you're never going to get rid of all of your swelling and you're going to have that puffy looking knee, because we know that any joint is 90% fluid. And so the only way that that fluid circulates is by going through a full excursion of motion. Well, you can imagine if I can't fully straighten my knee, then certain parts of that knee are never going to circulate the fluid again. And so you're going to be left with that chronic, perpetual little bit of swelling left. The other thing that it means is if you can't lock your knee out, your knee can never rest, really, right? Because like if we just lock our knees out, now we're not using muscles to stand up, we're resting on our passive joint. Well, if I can't do that, that means at some point my quad is always going to be turned on, which means what a lot of patients will report is if they're standing for long periods of time, that they always get really tired and that their knee starts to ache because they can't actually rest it. And finally, from a functional standpoint, if I can't get full knee extension, I'm never going to be able to get full strength back. I'm not going to be able to get full power production back. And so as far as moving weight in the gym, but also any type of running or even long walks, you're going to feel that deficit, and that is what we're trying to avoid. And so what I want to do is go through IDPT's protocol for restoring that full extension range of motion and what gets us amazing outcomes with our patients in person. So the first and the absolute fundamental exercise are quad sets. And I know that anywhere you go, you're going to do this exercise. The problem that I see with it is a couple things. One, people focus on really just like kind of like blindly banging them out really fast. The other thing is actually not doing them enough. So I don't want to underappreciate the value of this, but also the volume that's required to get this exercise going. The reason it's so important is because it's going to get the quad engaged and it's going to start pushing us into knee extension actively. If you watch my last YouTube video about ACL, about the top 5 ACL mistakes, the first mistake that I mentioned is people trying to stretch their knee into full extension or into full flexion. Remember, guys, the knee is a joint, which means we cannot stretch it into a range of motion. We need to actively bring it into that, okay? So what we're going to do is have something supporting under our knee. So the only reason we have this is so that the knee isn't floating, being that you don't have that knee extension back. So something to support it here. Then what I want you to do is drive that knee down into the towel as you pull your toes towards you and engage this quad. On average, we want to hold this for about 3 seconds. And really from day one, we're starting this exercise. And at one time, I'm looking at 3, 4, 5, 6 sets of 20 reps. And as that gets easy, I want to go literally hundreds of repetitions per day. Now, when we're here in the office, another way we like to progress this is by using stim onto the quad to further recruit that muscle. We use NMES, that stands for neuromuscular electrical stimulation. It is not the same as a TENS unit. A TENS unit is for pain relief. That is not the type of stim that we're looking to use. The other thing that we use is BFR, or blood flow restriction training. So what that does is actually cut off some amount of blood supply to and from the area to put your muscle in a hypoxic environment, which will essentially make the muscle burn more and actually make it have to work a lot harder. Being that you're going to be doing this at home, I would just say up your volume, up your amount of reps, up your amount of sets, because you're not going to be able to reproduce what BFR and what stim can do for your quad. The best progression for this is a straight leg raise. And the biggest problem that I see with a straight leg raise is people actually rushing too fast to it. And the way I say that is, you know you're rushing too fast when you come up, you're unable to keep this knee locked out straight. And so if there's any type of bend in the knee, what that's going to do is, because gravity is coming down, it's actually going to do that and essentially put your knee in a moment of flexion, which then you'll feel a lot of inflammation and just bothersome in the front of the knee. So if you can't get that knee straight and control it through your quad, then it's too fast of a progression for you. What I usually have patients do it around the 2-week mark. So the way that I like to do it is I like to squeeze down, get that quad engaged like a quad set, and then you want to raise up to about other knee height. Anything past that, we're really focusing on the hip flexor and not the quad as much. So then we come down, keep it squeezed and up. Keep it squeezed and up. For this, I like to go around multiple sets of around 20 to 30 reps. The biggest problem is most people will complain of that hip flexor tightness. And so this is one where we're gonna do it just to hit that quad and challenge it a little more. But ultimately, this exercise is not the end all be all, because it's not necessarily hitting the most ideal part of the quad that we want. So this next exercise is really where we start getting unique. So if you notice on the first 2 exercises, our foot is off the ground. When we think about knee extension is associated with force production, aka putting force through the ground to push you forward. And so if our foot is off the ground for the first 2 exercises, they don't really translate to walking and becoming active again. All they're really good for is getting blood flow and muscle recruitment in the quad. This next exercise now starts to progress that and starts to actually get force production in the leg. The best part about it is that it's really safe after ACL surgery, because we're laying on the ground, so we're taking gravity essentially out of the equation. So there's no risk of real injury here. So what we're going to be doing is laying on the ground and putting the affected leg into the wall. We want to have a slight degree of knee flexion, so a little bit of the knee being bent. We don't want to try to lock the knee out. Okay? The way we're going to start this is that the other leg is bent with the foot flat on the ground. From here, we're going to lay down, get our low back nice and flat, and all we're going to do is focus on pushing the inside of our heel and the ball of our foot into the wall and holding. If we're doing this right, we're actually not going to feel much quad. We're going to feel more of that inside hamstring here, okay? What I like to do is push through the wall, and then I like to hold it for like 6 to 10 breaths. When we focus on our breathing cycle, we want to take a full but soft breath in through our nose and a long breath out through our mouth. We never want to breathe in through our mouth. And as we progress this, we're going to bring this other knee toward our chest and reach our other elbow towards that knee. These should not touch, and we should not be trying to crunch here. And then same thing, we're going to continue to push through the wall and feel that hamstring engage for about 6 to 10 breaths. You can picture that if we flipped ourselves to be upright right now, this looks like we're standing on one leg. Another unique exercise that we're going to do now is a revised version of a standing knee extension. So you can see we have 2 bands here. The top band is pulling the bottom of my thigh outward, and the bottom band is pulling the top of my shin inward. The reason why, guys, if you remember from my first video of the top 5 ACL mistakes, we talk about what normal knee mechanics look like. And if you remember, when we fully bend the knee, the shin bone actually turns inward in relationship to the bottom of the thigh. And when we fully straighten the knee, the shin bone turns outward in relationship to the bottom of the thigh. And so what this is going to do is go against those normal mechanics. And so what we do is take the back heel up off the ground and have our whole body weight on our front heel. We're going to do this without lifting our toes. From here, we're going to stand up nice and tall, and we're going to straighten our knee against these bands. When we do that, we're going to hold for 3 to 5 seconds, soften it, relax again, and come up and pull again. Now this exercise shouldn't hurt at all. So if you're feeling a pinching in the knee or any type of pain, you want to go back to all the earlier exercises. It tells us we need more knee extension before progressing to something standing because gravity's coming up. So bend that knee again, straighten against it. Feel the inside of your heel. You don't want to let your foot roll out to the side. What I like to recommend is about 15 to 20 reps of these as well. About 3 to 4 sets per day. And what you're going to feel is that quad working, and you're actually going to feel that glute working too because of how we're standing with all of our weight on this front leg. Now with these early exercises, we are combining these with all the knee flexion exercises around this timeline that I mentioned on our last video about restoring full knee flexion range of motion. Like I said earlier, the only way to get full range of motion back is by fluid circulating throughout the whole knee. So of course the knee extension is really important, but we also need to get knee flexion back so that we're getting that fluid to swish and not just get stagnant in one position. So we're gonna progress that straightened knee position against gravity to just a more dynamic activity. So this is a simple step up. One minor detail change on the way down. So we're going to go ahead, let's say with the affected leg, step up, drive that opposite elbow across, and we are focused on driving through this box, through the inside of our heel, being up nice and tall. Here's where it changes a little bit. As we step down, we're going to keep our nose over our front knee, and our back heel is not going to touch the ground. Okay, that's going to keep our tension and our weight over our front leg. And then from here, through the heel, we're going to drive back up. Hold there, come down, drive up. If we're getting our knee flexion range of motion back, then stepping down and holding here should not be an issue. If it is, go back to those earlier exercises. At the top, we're focusing on getting that knee straight and driving through the ground. The best way to progress this is by just putting weights in your hands and driving up and coming down just to load that leg more. All right, so we're gonna go back to that heel elevated on a ramp split squat that we did in the knee flexion video. If you remember in the knee flexion video, I focused more on staying on my front heel with the knee bent and getting that hamstring to contract. The difference here is we're gonna have our weight more forward and focus on that knee extension. So we're gonna goblet hold the weight. Okay, we're gonna drop straight down. When we stand up, we're keeping our weight forward on our front leg and trying to straighten our knee more. Okay, we're gonna drop down, get that knee straighter. Trying to drop down, get that knee straighter. What we don't wanna do is poke our hip out to the side. Typically, I like to go for about 8 to 12 reps, about 3 to 4 sets every other day. So what the next thing we're gonna work on are staggered RDLs. The focus here is getting that hamstring contracted. We're gonna go toes elevated up on a ramp, and we're gonna have a slight knee bend here. So we're gonna start focusing on that hip hinge and focusing on starting to load a straighter leg. So what we're gonna do is have our back toes elevated, and those toes are gonna be in line with the middle of our front foot. From here, we're gonna bring in the opposite hand the weight to the middle of our body without turning, and we're gonna RDL onto our back heel. As you can see, I keep a little bit of a knee bend here just so I don't hyperextend my knee, but other than that, I'm focusing on not arching my back or rounding my back. If I'm doing it right, I'm gonna feel that upper hamstring, lower glute area, and I should not be able to hit the ground because I'm focusing on pushing my hips back, not down. I'm gonna start doing these really light, maybe no weight at all around that 4 or 5 week mark. And then once we hit 6 weeks, we wanna start loading that pretty heavy. Now, if you've been watching this video, you're probably wondering, when am I gonna get on a leg extension machine? And I love this exercise for restoring full range of motion and for getting the quad fired up. However, I believe PTs and athletes jump to this exercise too soon. And the reason I say that is because if we really load this heavy when we don't have a quad that is back engaged and we don't have full range of motion, then if I'm kicked out here, we're putting so much stress on that patellar tendon. And patellar tendonitis is actually the biggest side effect of ACL surgery. And I don't actually believe that it's from the surgery. I believe it's because we load this patellar tendon up because the quad can't do its job. So I don't really like to start these until around the 6 to 8 week mark. The best progression for me to start these is first to go 2 up, 1 down. So what that means is we're gonna kick up with both, and then we're gonna take the affected leg. So I know I've been doing right this whole time, but I'm gonna show you left so you can see. So I'm gonna drop this leg and then lower down slowly with that affected leg. And then I'm not gonna kick up with just this leg. I'm gonna bring my other leg back and kick back up. So I'm gonna go down slow, and you can see that quad firing up. So kick here, Slow, 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 and here. The next way that I like to progress it is by going up with 2, dropping the other leg, and then holding there. I'm only going to do this when I know that I can actually start to really see my quad working and I don't feel it in the front of my knee. I'm going to hold this typically for 30 seconds all the way up to 2 minutes. And then from there, as we're getting more confident, we're not feeling pain as we do it, we can go single leg kickouts where we're going up and down, up and down. The biggest thing you want to avoid is trying to bend your knee all the way so that it kicks out here, because then it's going to be a lot of stress on your knee to get it back up. So you want to stop right before that and then kick back up. And I don't even put a number on these. I tell my athletes, like, just do so many of them until your quad feels like it wants to fall off. All right, so bonus exercise is we're gonna do a sled march and a sled drag. So if you're fortunate enough for your gym to have this piece of equipment, then you're in for a treat. So what we like to do is not really use this exercise, especially the sled march itself, until around that 8-week mark. And the reason that is as we're moving this sled forward, we need to push through the ground and create something called compression. So we're actually compressing the knee down to move it forward, which is amazing for strength and amazing for stability. However, you don't want to tack on stability and compression onto a knee that doesn't have full range of motion, because then you're essentially just stiffening your knee more. So that's my biggest gripe about these. I see athletes on Instagram, athletes online doing these at around 4 or 5 weeks. It's great because yes, you're going to get strong, but you're going to have a stiff knee because you're not going to be able to get that full knee extension range of motion back. So when we're doing this, we're going to have our heels up off the ground, and whatever leg is down is a leg that we're focusing on driving through the ground. And we're trying to straighten that hip and straighten that knee as it's the back leg that's on the ground. Strike down on the ground and then push the sled away. The other great way to use this sled is the exact opposite, and it's a sled drag. So on the sled drag, I'm going to come around to this side. Your focus on the front knee now, that's going to be the one that we push off of and the one that gets straighter. Obviously, you want to make sure you don't get your foot caught on the bottom of the sled, so we might not get full extension, but we're going to be really driving and using that front quad. All right, guys, I hope you found this helpful. To summarize, what we're going to do first is do anything we can just to get blood flow and muscle contraction in the quad. But then quickly, we want to make sure that our foot is anchored. So we're going to start with your foot on the wall because we take away the effect of gravity. And then from there, we're going to stand up with your foot on the ground, getting that quad contracted. And quickly, we're going to turn that into more dynamic movement through split squats, through RDLs. And then finally, we're going to be even more dynamic with a bonus, using the sled, getting moving, start sweating, start really feeling like an athlete again. So if you found this information helpful, please, guys, as always, like, share, subscribe. Anyone who's had ACL surgery, send this to them to make sure that they do not become a statistic and that they get full knee extension back. As always, this is not done in isolation, so pair this with all of the knee flexion range of motion exercises that we have on our last video. Thanks for watching, guys. Can't wait to see you soon.